Good afternoon, viewers. We are live again from Sakra World Hospital, Bangalore. Today we have with us Dr. Anil Kumar, Senior Consultant and Head of Pediatric Surgery. Welcome to this session, sir.
Thank you.
The topic of this session today is appendicitis in toddlers. Are we missing the diagnosis? Sir, I want to begin with asking you the fundamental question: what is appendicitis?
Yeah. See, appendix is a normal structure in our body. Okay. So each one of us have that appendix. We call it as an vestigial organ. It's a small part which is attached to the large intestine. So this is called appendix. Okay. So when there is an infection or the inflammation to the appendix, we call it as an appendicitis. Okay. See, this can happen secondary to the infection directly to the intestine, or there is a small connection from appendix to the large intestine. Okay. There may be blockage of that connection, maybe because of fecalith, worms, or any other stone formation or the infection. When that happens, the secretion in the appendix get filled up in the appendic lumen. So the appendix start getting distended. Okay. That's when it causes a severe pain. So that can progress to full-blown appendicitis.
Okay. And how common is this appendicitis in children?
Yeah, see, in children, it's like a toddler, first few years, and more than 5 years, more than 10 years. The different age group is there. The commonly it is there around 10 years age. So we start seeing the appendix after 5 years of age. But it can happen even less than 5 years also. Okay. So usually it is less common in less than 5 years. There's a high possibility that we may miss this diagnosis of appendicitis. Okay. Many a times we treat with generally if they don't come to the pediatric surgeon. As a pediatrician, they treat as a common pain abdomen. So if it missed, then they present with the complications. So it is common in children, less common in 5 years, but we should have a high index of suspicion when there is a severe pain abdomen which is not responding to the regular medications.
Is there a particular cause for the appendicitis to happen in children?
Yes, as I said, one is infection to the intestine, like gastroenteritis, we call it. No? Similarly, there may be infection in the appendix. Non-obstructive appendicitis, we call that. The second one is the obstructive cause for appendicitis. That is when there is a blockage to the lumen of the appendix with fecalomas or fecal stone formations or worms. Then it causes appendicitis.
So, are there any particular signs and symptoms that people can watch out for?
Yes, the appendix. No, it is. There is a triad of symptoms. It starts with severe pain abdomen, vomiting, followed by temperature. That is fever. Okay. So, if it is a severe appendicitis, it won't respond to the regular medication of pain medicine. Especially if it is an obstructive variety of appendicitis, the pain severity keep increasing whatever the medication we give. Generally, the kids complain of the pain around the umbilicus when it is started. Then gradually it will shift into the lower part of the abdomen, right lower part of the abdomen. Okay, even if you touch that area, he'll wince with lot of pain. Then in obstructive variety, they'll have a vomiting also. After a couple of hours today, they may start getting the fever. The important symptom is severe pain abdomen, sometimes associated with vomiting.
So, are there any particular tests to diagnose appendicitis?
See, one is clinical diagnosis. As I said, symptom-wise, if the patient presents with severe pain abdomen, vomiting, and the fever, on examination, in the right iliac fossa, that is lower abdomen on the right side, there will be severe pain, tenderness we call it. When we touch it, they wince with severe pain, and they protect with the muscle. That is called guarding and rigidity. When you have these signs, that is a high, the sign of appendicitis. Then we do ultrasound abdomen. Okay. So most of the time, ultrasound abdomen will pick up appendicitis. So there will be peculiar findings like the size of the appendix and the edema of the appendix. Sometimes if the infection level is more, there may be some fluid collection around the appendix. Okay. In case of if the appendix is behind the intestine, what we call it retrocecal appendicitis, it can be missed on ultrasound. Okay. When we have a high index of suspicion on examination that it could be appendicitis, and the ultrasound says they're not able to visualize the appendix, then we do CT scan. The simple a plain CT scan will pick up this appendicitis. And even the blood test also, the immediate blood test, you may not see the signs of infection. They present little later, probably 12 or 24 hours later, signs of infection will be there on the blood test.
And what can happen if the appendicitis is untreated?
So if it is a milder form of appendicitis where it's just an infection, so many times with a simple medication it get cured. But if it is an obstructive form of appendicitis, then it will progress to the complications. As I said, it's a small vestigial organ. So as the secretion get build up inside the appendix, it will get bloated and it may burst. So once the burst of appendix happen, the infection spread all over the abdomen, which we call it as peritonitis. Okay, and even the pus collection happen around that area. Okay, and it can cause a lot of infection in the tongue. Okay. So once we diagnose appendicitis, it has to be treated.
And once the surgery is done for appendicitis, any other complications can happen after that?
Now, first thing is the treatment. What treatment is for the appendicitis? Okay, it is not the medical line of treatment. Many times medical treatment can help when you don't know it is an appendix. If the milder form of infection, you treat with an antibiotic and pain medicine, you may respond. But those cases comes back with more severity of appendicitis. Okay. So once we diagnose it as an appendicitis, it has to be treated by surgery. So removing the appendix is the treatment. So there are two approach of treatment. One is called open appendicectomy, and second one is laparoscopic appendicectomy. Okay. In open appendicectomy, generally abdomen is opened and the appendix is removed. In the laparoscopy, it's a keyhole surgery, where only few instruments, small 5 mm holes will be made in the tummy, and using the instrument we take out. So nowadays, laparoscopic appendicectomy is the gold standard treatment for acute appendicitis. So in children, it is a challenge because we don't have a adequate space in the abdomen. So that is a challenge, but we do laparoscopic appendicectomy for even the small babies, like small less than 10 kg baby, even a year-old babies when they present with appendicitis. In our institute, in our Sakra Hospital, as a pediatric surgery department, we do a laparoscopic appendicectomy as an emergency and as an elect.
Okay. And so then after the surgery, any complications?
See, there is no complication related to the surgery. Okay, it is like any other surgery, but there may be a complication related to the disease itself. Okay. If they present late, the severity of the infection inside the abdomen is more. Okay, say there is a pus formation, the rupture, peritonitis. Okay, we remove the appendix, give a wash, clean it. But still, there are two complications of the disease can happen, not the surgery, of the disease. So one is collection of pus inside the tummy. Okay, that is called pus collection. Usually they present after 4th, 5th or a week's time. When they have a high grade fever post surgery, we need to look for this. What is called as collection, that is pus collection. The second complication is what is called as subacute intestinal or adhesive intestinal obstruction. This complication can happen after any abdomen surgery. Okay. See, normally the intestine don't stick to each other. Okay, because of that property. So once the infection happens, that particular character or property of the intestine will be lost. So they will be adherent to each other. Sometimes if the kinking happens, they may present with obstruction. This is called adhesive intestinal obstruction. But many a time it is conservative treatment. Whereas if there is a pus collection, then we need to find out the collection under ultrasound. If it's a significant, then we have to remove the pus under ultrasound guidance.
And how much time after the treatment does it take for the children to get better?
If it is a simple appendicitis where the appendix infection or appendicitis confined to the appendix, rest of the abdomen is not affected. Once we remove the appendix, then the baby's recovery will be faster. Generally, in those cases, 48 hours hospital stay is required. If it is a complicated appendix where it's a ruptured and peritonitis and pus collections, they require IV antibiotic to cure that infection part. So in those cases, they stay in the hospital for 5 days or so. Okay. So once this process is over, the recovery is very fast. As I said, we do laparoscopic surgery. In a week's time, nearly 80% of the kids will do well. Okay. Maximum by 2 weeks, they'll come back to the normal activities.
So you've told us about the surgery and about the treatment. Also want to understand, is there a way to prevent appendicitis?
No, there is no way to prevent. It can happen to anyone. Okay. See, some of the cause for appendicitis, it's a stone formation, the fecal formation. Some relation is there with the constipation. If the child has a constipation, possibility of they getting the appendicitis is high. So all appendix cannot be prevented. Okay. It can happen at any age, at any time. So high index of suspicion is required for this.
So with this, we come to the end of our session. As a last question, I want to ask you, is there any take-home message that you want to give to the patients?
Yes, especially the small children or children's, you say, the pain abdomen is the commonest symptom or a problem they face with. There are various reasons for that. So in that, commonest reason is the constipation or tummy upset. Okay, whenever there is a pain, generally as a parents, as a general doctors, they think about these things only, they try to treat it. Okay, so that is fine. But when they don't respond to the regular medications, if the severity of the pain is increasing, if the pain is disturbing their day-to-day activity, if the pain is disturbing their sleep, then you have to think that something major or like appendicitis kind of a things may be the possibilities in the abdomen. Okay. In those cases, it's always better to go to the center where the facility of ultrasound and facility of pediatric surgeons around the clock are available, so that this problem can be diagnosed on time and it can be managed. Because once we diagnose the appendicitis, we don't plan the surgery for a few days or few weeks later. It is like an emergency. Even if they come in the midnight, if the severity of the appendicitis is very high, we are suspecting that possibility of the rupture, possibility of the complication, we do surgery even in the midnight also. So hence, better not to delay when the severity of the symptoms are very high. So that is what my message to the audience and the parents. Okay, don't neglect the severe pain abdomens. If there is a appendicitis diagnosed, the treatment is surgery that has to be done for the betterment of the child.
So this was a very informative session. Thank you, sir, for joining us, and thank you, viewers, who have joined us for this session. If you have any questions, you can share them in the comment section, and our experts will answer them for you. Thank you.